It's tempting to assume that because Victoria has gone into much more extreme lockdown, the previous strategy failed. But that's actually not true. New research from the Burnet Institute, exclusive to 730, has shown just how bad the numbers in Victoria would have been without the Stage 3 lockdown. Before Melbourne introduced Stage 3 lockdowns, the reproduction number was 1.75. That means for every 10 infected people, they were passing the virus on to more than 17 others. The Level 3 restrictions brought that infection rate down to just over 11 people, which means that about 20,000 infections were avoided during July.
We can assume we would have had 3 to 4 times the number of deaths, 3 to 4 times the number of serious illnesses. So a very major impact of Stage 3 lockdown.
But according to Professor Brendan Crabb from the Burnet Institute, it would be a mistake to assume that the new measures put in place yesterday aren't necessary. There are still too many people being infected.
Well, we're still left with a community spread that is growing very slightly, just above an R0 of 1. Perhaps masks kicking in is going to take that closer to 1. We don't know the answer to that yet. So we don't have an epidemic in decline. We have the rate decreasing, but not an epidemic yet going down to zero, to elimination, which is where we want to get to in the community.
Given reports of poor compliance with isolation and distancing in Victoria and signs of community fatigue, Professor Crabb and his colleagues argue that getting communities to suggest what messaging will work for them is the answer, not more fines.
Punitive approaches announced at a press conference simply don't affect too many people. You need a different approach. You need a community-centric approach.
And they say contact tracing needs to be greatly improved.
The community would love not to be taking lockdown measures, but still dealing with COVID. And of course, that requires that you do know pretty much where every case comes from, that your systems are so strong and so spread out in the community that they detect all those cases. We don't have that system quite yet. And so we have to go to these, really draconian, harsh measures that I support, but make me feel slightly sick in the stomach at the same time.
Working out where people caught the virus and who they passed it on to is the foundation of Australia's response. So how has this not stopped the number of Victoria's cases growing? And why are we only now discovering that there are hundreds of people who've been infected by unknown sources?
In Victoria, we probably had a reintroduction of the virus through a number of different guards who'd become infected through the work connections. So we had it taking off in multiple parts of the community before we were aware that we really had this second wave of community transmission happening.
With each infected person having up to 10 contacts, there must be a limit to how many cases contact tracers can manage at one time. Has Victoria hit that limit?
We know we've got over 2,000 people working on this, both people in Victoria and also interstate healthcare workers. They've suggested the capacity allows them to deal with up to 800 new cases a day, assuming they all need this sort of intensive follow-up.
The state has also been compared unfavourably to New South Wales, where contact tracers have been able to quickly pin down the source of almost all COVID infections.
In New South Wales, they had a real advantage over Victoria. They could not only do the contact tracing with fewer cases and be really aggressive about that, but they could put the call out for locations where they felt that was a source where each case had become infected. So the Crossroads initially, but then the Thai restaurant and so on. And that's a powerful tool that Victoria never had.
So what is the payoff for Melburnians in return for the pain of this progressive lockdown?
The payoff is the elimination of the virus from the community. It will mean a radical difference to Victoria and a radical difference to New South Wales.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.